As a cat owner, you'll usually notice immediately if your cat is behaving differently to usual. If it seems lethargic, won't touch its food and has diarrhea, you'll certainly be worried. But diarrhea, just like in humans, has a cleansing function. There's something in the gut that needs to be expelled quickly. So it's actually a clever reaction of the cat's body. The important question is, what is your pet reacting to with this symptom? The causes can be very different and range from harmless to serious. In general, if your pet is overall in a bad way, or the diarrhea lasts longer than 1 or 2 days, you should consult with a vet without delay. The same applies if it has symptoms such as fever, weakness, or trembling. When we start investigating the cause, we distinguish between internal and external factors. For example, external causes might be spoiled food, cleaning agents, toxins, and poisonous plants. A change in diet can also trigger a reaction. Internal factors including diseases must also be considered. Hello. Please lift your cat onto the table. Fluffy is suffering from diarrhea, right? That's right. Roughly how long has this been going on for? Maybe 2 to 3 days? Is he vomiting as well? No. Is he eating? Difficult to say. I'd say less than usual. And the diarrhea, is it mushy, watery, or is it more like a soft sausage? It's a bit mushy, I'd say. Does it contain any blood? No, I didn't notice any blood. Have you changed his diet in any way? Is he eating something he's not used to? No. I'll have a look at the mucous membranes. If these membranes are slightly dry to touch, it's an indication he's a bit dehydrated. Okay. Yes, they're a little sticky. So he has lost a lot of fluid due to the diarrhea. Let's feel the tummy. It's a little bit tense. That's not surprising. If he's had diarrhea for a few days, the internal mucosa is likely to be irritated. Let's listen to his chest. Heart and lungs are very good. Great. Okay. There are of course some organic diseases, problems that can lead to diarrhea, but I think Fluffy is generally in good health. He just has an upset tummy. I'd like to give him an infusion because he's a bit dehydrated. And apart from that, I'd recommend a special diet. Give him something light, easy on the stomach, and he should be back to normal in a few days. Oh, great. Keep an eye on things while your cat is unwell. Check that it is eating and drinking regularly and monitor its feces. Make sure that it doesn't get dehydrated. If you notice that your cat is not drinking, you might have to add an electrolyte solution at some point, with added glucose if needed. If there's another reason for the diarrhea, such as infectious disease, additional medication may be necessary. I'll take a scoop or 2 from this diarrhea sample and send it to the lab to rule out whether he has any parasites. To help stabilize your cat's gastrointestinal tract, many manufacturers have veterinary foods that are adapted to suit your cat's intestinal health. These special foods are available, for example, from Hills or Concept for Life. They provide an optimal mix of soluble and insoluble fibers, so-called prebiotics, and form the nutritional basis for good gut bacteria. A high omega-3 fatty acid content can also have an anti-inflammatory effect and a positive influence on gut flora. This all helps to deal with the issue of diarrhea quickly. And make sure that your cat always has plenty of fresh drinking water. Along with a light diet, drinking lots of water is really important and will help your cat to recover more quickly. Of course, you can't control your cat's health completely. However, you can help to prevent a whole range of digestive problems. Watch out for any behavioral changes, especially in cats that roam outdoors, as they're far more likely to eat something harmful. If mild diarrhea symptoms occur frequently, you should make a permanent change to your cat's diet after consulting the vet and ruling out other causes. I hope you'll find my tips helpful, and I hope your cat gets better soon.